We're going to transformative policies, and for that we have a moderator who is called Michel Yanclus. He's from Health and Climate Foundation in France, and he will do that together with Davide Ziveri. He's from the Humanity and Inclusion in Belgium. Let's see if Michel and Davide are there to take it over from me.
Yes, do you hear me? Can I?
Yeah.
Yep. Can I start?
Yeah, please, please, Michel.
Yeah. Bonjour à tous.
Good morning or good afternoon. I'm very pleased to be able to introduce this session. This is a very important session according to me, because we have some presentations and we will base ourselves on what took place also in the Netherlands, and we will be able to share our point of views and also the lessons we drew from our different activities. Climate change and also climate emergency, we know that it is irreversible, that it will take place, that it will impact us all, and certainly the most vulnerable. Some will be more exposed than others, some will be more vulnerable than others. And because of that certainty, we need to be ready to face different situations we didn't know in the past. Today we have two presentations. These are emergency presentation. We have one in Mozambique and one in Sudan, two situations where water supply, also where flooding, the impact is really detrimental to population and to healthcare systems. I would like, and this is the introduction, basically, I would like to say that we are not going to limit ourselves to emergency management. I would like to make two comments. First, anticipation. We know we will have problems, but in our reactions, how can we anticipate what's going to happen in the future? And here I would like to talk about three areas of anticipation. First, how can we work with the existing information services? They exist today. We are talking about new technologies, satellite communication, to integrate a local situation with climate predictive models. How can we use this information? How can we make a link with our epidemiological knowledge in order to develop warning systems? And this will be great in the future. For instance, alongside the coast, we know there will be an increase of water level. How can we, for instance, move some infrastructure? How can we better manage water sanitation plan? How can we better use the IT technologies? It was my first item. My second item, because we are also looking for new opportunities, how can we reinforce malfunctioning systems, for instance, in slums, in some vulnerable areas? As far as sanitation is concerned, we are talking about, of course, drink water, also water sanitation management, clean water, wastewater, fighting against pollution, against diseases because of rodents. How can we, for instance, fight against rats, against rodents? And then the third element, how can we have a better, how can we better envisage the problems encountered by vulnerable groups? And that would be very innovative.
I really would like to stay in touch, and see how we can learn from it.
Je n'entends plus rien là.
I've lost the sound, says the gentleman.
Oui. Qu'est-ce que je dois faire?
Vous pouvez continuer, tout va bien.
Everything is under control. There was a small video that was launched, but okay. Yes, so this is for the anticipation. How can we better understand vulnerable groups and how they can react, for instance, a better supply system for school supplies, better access to insurance system against climate hazards and so on and so forth. And then the second item, and I shall be very brief. Well, we need to reconstruct, for instance, if there has been a climate hazards, how can we afterwards reconstruct, rebuild a system, for instance? That's also very important, and it can, of course, cover different aspects. For instance, the access to local services. How can we, for instance, take care of the elderly, disabled, also people socially excluded. Also, when reconstructing the system, we have we can revamp the sanitation systems. We can also cooperate more, collaborate more with the local partners. We can enhance the dialogue between the different partners. These were just a few possibilities as an introduction. Maybe it's a little bit theoretical, but I hope that this will be food for thought. And at the end of this session, I hope we will be able to come up with suggestions for the future. Thank you very much and have a nice session.
Thank you, Michel. So good morning, good afternoon, or good evening, everyone. My name is Davide Ziveri. I am environmental health specialist at Humanity and Inclusion, the new name of Handicap International, an NGO engaged, among other goals, to making climate action inclusive and to facilitate participation of persons with disabilities and marginalized and underrepresented groups that are already have been mentioned in between line in the introduction by Michel. So Michel already made clear that today we are focusing on solution and to transformative policies at the implementation level via three amazing presentation now. So first of all, we'll have the pleasure to listen to Rob Daunt, a bioscience engineer working for almost 10 years as environmental health officer at MSF, Médecins Sans Frontières, working in different emergencies and health emergencies. We will focus on flood response in South Sudan. Then we'll pass the floor to Akila Munir and Lawrence Jansen from Inabel, being Akila the focal point for the project on climate smart development using renewable energy for sustainable access to safe and affordable drinking water in Mozambique. And finally, we come back to Europe in this community we are representing with the intervention of Winnie van Orden, passionate for health equity and ecological justice. She's working as junior researcher and project officer at Commons Network Foundation in Amsterdam. And we have the pleasure to listen to her call for degrowth for planetary health. So just let's start. Rob, the floor is yours. Thank you.
Yes, okay. Hello, good afternoon, everybody. Nice. Yes, voila. So thank you, Davide. So as said, my name is Rob. I'm working at the Environmental Health Unit of Doctors Without Borders, or MSF. And in the coming 10 minutes, I will present you some preliminary results of a study that we are doing about two consecutive flood interventions in Pibor, South Sudan. So with the central question, if a climate lens can improve humanitarian response to floods. So first, a small words on Pibor County in South Sudan. So it's home to the Murle people, which is a pastoralist society. So cattle is very important. in that society, and there's a lot of seasonal movement of people that move with their cattle. There's also quite a lot of violence in the area, linked to the conflict in South Sudan, but also linked to cattle raidings that happens between different groups. Because of that violence, amongst others, there is also quite some internal displacement within Pibor County. And there is and has been since a while a critical malnutrition risk. So quite a lot of factors of vulnerability that come together there. It's a country that is located, as you see on the map on the right, at a confluence of different rivers coming also from Ethiopia highlands. So it is a country with where seasonal floods are quite common. And MSF there is present since a couple of years supporting primary healthcare and maternity. So seasonal floods are common, but in 2019 and 2020, these were exceptionally large. In the whole of South Sudan, in both years, there were over 1 million internally displaced or affected because of floods. And so this is two maps of October 2019 and 2020, where in Pibor County, so on the centrally east in the red circle, where there were respectively 100,000 and 150,000 affected or displaced people in there. So this is the two cases that we look at, two cases of floods where MSF intervened that we are going to look at. So the objectives of this study are to document and analyze our flood preparedness and response process over those 2 years. And so we have a bit the advantage, if you can call it like that, to be able to look at 2 consecutive years and also to see, okay, which lessons learned from 2019 were actually applied in 2020. So to come to a better understanding of how things improved over time. So it's a qualitative study consisting of a documents review and also of key informant interviews. So with the people involved in the planning or implementation process. The limitations are that it's a retrospective study and that no community members or local staff from Pibor are involved or interviewed for this. So in terms of outcomes, preliminary outcomes, I come back to the title, so climate lens. So we found that the climate lens has to be interpreted very widely in a way. There is the obvious and very well-developed tools, such as were presented before, information technology, for example, through meteorological models, flood risk models, and so on, which can give very useful data. But Pibor, again, I have a map here of GLOFAS, so Global Flood Awareness System map, where Pibor is in the red circle again, and there's very little data available there. This is from 2020, just before the flood happens. So it shows that Pibor is a very data scarce region. So it's good to understand and to follow those models in terms of understanding of trends of what will come. But it's not very useful in terms of really defining triggers for action. So because on the right side, you see a picture of a few days later, and the situation in Pibor was actually already very, quite heavily flooded. So just a few days later, after the first alert actually happened on GLOFAS. So it's really this integration of global information systems, meteorological and flood risk models, and so on, with really local data, local triggers that can help better anticipate or better be prepared. A third source of information, which is community knowledge and experience, is also very important, but that's something that came out from our study that MSF, we are not enough taking advantage of that kind of information. So that's certainly something to work further on in the future. So a second preliminary result is that because in 2020 we made use of those local triggers, which at the time were, okay, when actually the old health center started flooding, so the location of the whole center, the whole old health center, this was an indication for the teams to actually, okay, the flood is coming, it's getting bad, and to put in place the preparedness plan. So that was something that was done in 2020, much more than in 2019, and it's really made that there were much more timely actions done. So here in this table, I just list for both years when different activities were being implemented, as opposed to when the flood started or when it peaked. And it shows that in 2020, we were much more in time. So stock were relocated actually a big part before the flood happens. We were able to have a team throughout the flood intervention. We were able to continue the functioning of our health facility throughout the whole flood. We were able to start mobile clinics before the flood actually happened, and even increased during the flood. And also we were able to upscale our emergency water provision. So comparing that to 2019, we were much more on time, and this really improved a lot the response that was able to put in place. So I call it here moving from damage control, while we're not prepared, to more controlled chaos with a better preparation in place and triggers to start early actions. On the mobile clinic specifically, that's really also a success, if I can say so, from 2020. So it was a key component from the start of the intervention. So mobile clinics were put in place in hard to reach areas as a way of relief. So bringing primary healthcare to those locations, but at the same time also in a way of assessment. So really checking the health status and location and number of people on those locations. So this was done much better in 2020 than in 2019, with 5 mobile clinics moving according to accessibility throughout that period. So on the right, there's a table, a graph showing the number of consultations done in 2020 compared to the black line in 2019. And throughout the flood, we had more or less the double amount of consultations we achieved to do in 2020 because of these mobile clinics. So really mobility in flood response means access to the population and improved results. And also these mobile clinics were entry points for preventative measures, for distribution of bed nets, distribution of jerry cans, and so on, which is also an achievement. Again, the question there was on community proximity. And there, a remark that came back is that the better collaboration with Veterinary Sans Frontières, who really focused on cattle, could have improved our response. Because in a flood, what often came back is that the cattle is really the primary concern of the people. So linking better with a response to cattle could have improved our health response as well. This is just a brief slide on the kind of the disease patterns we saw during the intervention in 2020, or the epidemiology. So malaria was a really big health concern already before the flood, with up to 70–80% of positivity of malaria in our population. Then respiratory tract infections were important. Malnutrition was already bad before, but after the flood, it increased to really critical levels. And there was actually also a measles outbreak that was occurring during, before the flood. Rates in the area. So almost coming to the end, but what we really see from the results is that the preparedness package, it's really a progressing issue in MSF. So it improved greatly in 2020 as opposed to 2019, but there's a whole a range of issues that need to be in place to have proper preparedness and proper intervention. So of course, this comes back to flood risk understanding and this local alert that I talked about, to be ready on time with activities. Also to have the practical experience, which unfortunately we gained in the hard way in 2019. Practical experience of how things could be best put up, how to best reach people, which locations are the safest, and so on. Really making use of pre-positioning of kits, which really helped a lot. Kits in terms of water provision, kits for malaria, for example, for bed nets, but also specific kits for snake bites, cholera alerts, and so on. Have those ready and in place, and this really allows them to be deployed quickly. There's a need of HR continuity, so human resource continuity and expertise during the intervention. An example on the right is an emergency water provision that was set up. This is quite a heavy system to keep running during a flood, so you really need the people and the expertise to keep this running. And also preparedness also comes mentally. If teams are aware of the difficult condition they will be working in during a flood, this helps also their working, the way they work and the intervention. So conclusions. Understanding of flood risk, preparedness, and anticipation really improve flood relief, but the way is still long. So for MSF, this is really changing habits in a way of making use of flood forecasts and so on to really start thinking of true preparedness for extreme weather events. We to date have no dedicated person yet that works on this kind of information brokerage on flood forecasting and so on to communicate this to field teams, and community links are underused. And so that's really a working point from our point of view. So next steps for this study is, it's actually part of a thesis work for Institute of Tropical Medicine. We will use this to influence MSF flood guides and preparedness plans for projects, and actually to push for kind of reflection in on MSF's operational adaptation to the climate crisis. So thank you very much, and here's my context for further questions.
Thank you, Rob. It was very clear and very concrete. If there is any question, please put it in the Q&A or your comments in the chat. We left space for that at the end, before the end of the panel. So now let's jump to Mozambique. We already heard about how climate change and climate crisis consequences are dramatically real in Mozambique before in the conference. But now let's focus on what it could be done. So please, Akila, the floor is yours.
Thank you. Good afternoon, everyone. We're very excited that our concept note was selected for the Because Health Series 2021. And I am the National Strategy Advisor for Enable in Mozambique, and I'm here to further elaborate on our concept note on the topic of climate change and improving access to drinking water and population health. So let's get to it. Enable is the Belgian development agency which implements the international development policy for Belgium. We work within the framework of the SDG agenda and the 5 global challenges identified in our strategy. These 5 global challenges are centered around environment and climate change, human mobility, peace and security, social and economic inequalities, as well as urbanization. If you look at the map to the right, you will see a very interesting depiction of Enable's water projects across Africa. And in the sub-Saharan African region, that is where Mozambique is located across the coast. And you will see that our projects are focused on drinking water. Belgium and Mozambique have been partners for more than 20 years. And Enable has been active in 6 out of the country's 11 provinces. That is significantly a high number of provinces because Mozambique is widely dispersed. We work mainly within the water, energy, and food nexus, but through delegated cooperation, we also intervene in the health sector and the public financial management sector. So what was the philosophy behind the elaboration of this water project in Mozambique? We can analyze it briefly from 3 perspectives. The first perspective is from climate change. As Davide was saying, Mozambique is one of the most affected countries to climate change in the African continent. This has been more evident in the last few years, where catastrophic climate events have become recurrent. To further illustrate, in 2019, Mozambique was hit with Cyclone Idai and Cyclone Kenneth. Cyclone Idai was considered to be one of the worst natural disasters to hit the sub-Saharan African region in the last 20 years. In addition to that, the rising sea levels have contributed to saline water seeping more quickly into the water basins. This has degraded the water quality, which makes it unfit for human consumption. From an environmental perspective, due to geomorphological features, majority of the water in our intervention zone was brackish. As a result, most of the water pumped was also not fit for human consumption. The salt content in the water contributed to the degradation of the pumps, as well as compromised the integrity of the concrete. This affected the infrastructure of the pumps itself. From a structural perspective, the local water committee had limited technical capacity to oversee the water sites, and there was a limited share of revenue that was allocated for the repairs of the equipment because of the selling price of water. also the management choice to install hand pumps was not sustainable in the long run because of the high malfunction rates, the limited access to spare parts in the Mozambican market, as well as the limited technical capacity of local staff to maintain it. This further contributed to the deterioration of the equipment and infrastructure. That, in conjunction with the fact that the quality of water was degrading and unfit for human consumption, left the population in a situation where there was reduced access to drinking water and brought along with it serious health problems. Untreated water can result in several health situations, including acute respiratory illnesses, diarrheal diseases, skin diseases, and can be particularly harmful to pregnant women, which can suffer from hypertension and in severe cases, miscarriages as well. The population didn't always have an alternative, but to drink salt water. But in some scenarios, they would migrate and settle in other areas, near shallows, near rivers, but in the context of Mozambique, these areas are also prone to flooding. So Enable elaborated the Gaza water supply project, which had the objective of improving access to and control of water supply in a sustainable manner for the rural population of the northern part of the Gaza province. The project as a whole lasted for 6 years, and it was implemented together with our local partners, which was the Ministry of Public Works and Housing, as well as the National Directorate of Water Supply and Sanitation. The component of the desalination units had an estimated budget of 600,000 euros, and this component ran between 2017 and 2019. When we take a closer look at the project, some key facts emerged. The project introduced an innovative technology of desalination, which previously was rarely used in Mozambique. This was in the form of supplying and installing 6 desalination units, which were powered with solar energy without the use of batteries. And this resulted in supplying safe and drinkable water to approximately 8,700 inhabitants. Additionally, the safe deposits that were left as a result of the desalination process, which could be particularly harmful to the health if they went back into the ground, these were safely disposed of with the help of the private sector. The existence of these infrastructures in villages in areas where previously had no drinkable water meant that women and girls who traditionally had water fetching chores now had more time to either study or to engage in income generating activities that can contribute to food security. The project as a whole was redesigned to be climate responsive, and this contributed to having greater availability of a better quality of drinking water, which had a positive impact not only on the hygiene, but also on the health conditions of the beneficiaries. We've already touched upon some of the direct and indirect results of the project, but now we'll look at it from the perspective of climate, gender, and health. The desalination units were powered using solar energy. This meant that there was a reduction in CO2 emissions, and for the population, which was really important, this also meant a reduction of energy costs. This is a concrete example of a climate change mitigation action. From a gender perspective, the existence of the infrastructure in their villages and in their districts meant that women and girls who previously had to travel kilometers to fetch drinkable water, or at times just water, even if it was not of drinkable quality, now had more time. They had more time to either study or to get involved in income generating activities. And this is where the health element comes into play. Them involving themselves in income generating activities could lead them to have better access to food, which contributes to food and nutrition security. At the same time, the existence of these infrastructures for the entire community provided them with sustainable and safe drinkable water, which contributes to water security. These factors contributed to the improvement of the health of the population, which was an indirect impact, but a valuable indirect impact nonetheless. The project also had components of innovation and training, which we found were very important and necessary for the sustainability of the project. We supported through the creation of a water database for reporting purposes. We trained local technicians to be able to use that database after the intervention was concluded, and we made available mobile water testing equipment. With these tools, regional authorities were better equipped to take faster and more appropriate decisions after climate disasters. When designing innovation into our project, we took into consideration the climate change context of the country. This was also seen in the decision to select desalination units for the areas in intervention that only had brackish water. And when we did our site selection, we also selected areas that were prone to host climate refugees. Some of the lessons learned that we realized throughout the intervention was that flexibility is really important so that we're able to adjust the activities and the outputs to the reality of the context that we work in, especially climate change. Involving the communities was vital to make sure that there was ownership of the infrastructures, ownership of the behavioral change even after the intervention was concluded. We live in an era where technology is everywhere, and while it's an advantage, we need to make sure that these are adapted to the local context so that the community and the population can see them as an engine of transition. And this was something that we took into consideration while elaborating the project. We all want our interventions to be sustainable, and some of the factors in our case that contributed to the sustainability of the project was involving local actors in all phases of the projects, introducing digitalization initiatives, having data monitoring tools, and the involvement of the private sector. This was definitely key. With all the rapid technological developments that occur in the water sector, we have to constantly evaluate all the options available to make sure that we match what is available with our context and make sure it's relevant to each other. Last but not least, one of the lessons learned we realized is that improving the health of the population is a highly valuable indirect impact of a project such as this one. The desalination component of our project was definitely a pilot initiative for Enable and also in Mozambique. And I have to say, proudly have to say that it was a successful pilot initiative. This was then translated into national strategies, one of them being the National Climate Change Adaptation and Mitigation Strategy of the country, where they explicitly mentioned the technology of desalination to be further developed. And it was also then seen in the National Rural Water Supply Program that desalination should be taken into consideration as a viable solution for areas where water is brackish. This was put in place after Enable's project and after setting up a desalination task force, which Enable was also a part of. In conclusion, we have to remember that climate change is happening right now, and water is a big part of the solution while being under risk. The projected decreases in rainfall, the increases in temperature, and the acceleration of saline intrusion into the water bodies may likely jeopardize our water availability, our food security, our health, and our economic growth. We have to continue implementing new climate responsive technology because this is part of the preventive measures that we need to put in place to ensure water security, especially in a time where our water resources are decreasing, but the demand for water is increasing, especially post-climate disasters and population displacement. The use of digitalization tools and data monitoring tools can help us have in-depth knowledge of water resource, which can then inform in faster decision-making and subsequently increase the community's resilience. The financing for the desalination component of the project was supported by the Brussels Environment Region and the Brussels Capital Region. And I'd like to thank you for your time and happy to answer any questions if you have them.
Thank you, Akila. Thanks a lot for this real world case. amazing job done and a lot to be done. But what we learned during the World Conference so far is that local project and solution, as you and Rob shows, also have to be sustained for a systemic change. And systemic change is also nourished by lifestyle in other parts of the world. So I wish to let the floor to Winnie to explore other and different or alternative ways to being on the planet and to structure our economies in a different way. Winnie, the floor is yours.
Thanks, Davide. I hope everyone hears me well. I am going to share screen. Okay. So I hope you all see my presentation now. You do? Okay, perfect. So I'm gonna, so first of all, it's really great to be here at this amazing and important conference on climate justice and health equity. I am calling in from Amsterdam, where I am based, and I work here for a Commons Network. We are a collaboratory for the social and ecological transition, and we explore new models for the economy and society. So today I'll be talking to you about the what I call the planetary health need for a degrowth transformation. First, very shortly, I believe the term planetary health, it was coined during this, or it was put during this conference numerous times already. But when we talk about planetary health, we talk about really this new narrative in understanding human health, where we start from the basis of ecology and the functioning of the Earth's natural systems. So why then, in the context of planetary health, do we need to talk about growth? So we know today that there's this dominant belief that regardless how wealthy a country becomes, its economy should continue to grow. Its GDP, gross domestic product, should continue to rise. So it's this ideology of growth as good for health, human well-being, and functioning societies, and the fact that it justifies our efforts to create economies that need more growth just to stay afloat, basically, is what the degrowth movement wants to challenge. So what degrowth advocates basically say is that it's this ideology that needs to be tackled if we really want to overcome the ecological crisis. So what you see here at the back, it's the pattern of the great acceleration, a term you might have heard, and the planetary boundaries framework. Both of them often pop up when we talk about our ecological crisis. So we know the planetary boundaries that we already surpassed 4 of them by now, of which climate change is only 1. And what's interesting and what's important to state here is that when we talk about the ecological crisis, we often talk about the Anthropocene. So what degrowth scholars then say is that this narrative of the Anthropocene, it basically states that it's human beings as such who are driving currently the state of the natural systems of the Earth. But in that way, it undermines what is really happening here, and that's the fact that it's a crisis which is caused by a particular sort of economic system. And it's an economic system that is predicated on a perpetual expansion, disproportionately benefiting only a small portion of the world population who are predominantly living in the global north.
Sorry, Winnie, sorry to interrupt you, but we cannot follow the slides. The slides are frozen at the first one.
Oh, shit. Okay.
They don't pass from one to another.
Let me see. So they're not, still not?
Still not.
Okay, wait. I'll maybe stop sharing screen.
Maybe stop sharing and restarting sharing the screen. Thank you.
Thanks for interrupting, otherwise it would be a waste. So do you see the other slide now?
Yes, now it seems working. Thank you.
Okay, so wait, see if I can. How does this work if I? Yeah, okay, we're there. You see it moving now, right?
Yes, perfect.
Okay,
Go ahead.
thanks. So what I was saying is that it's so the crucial question to ask here is what is really driving the ecological crisis. So it's an important question that degrowth and post-growth scholars put forth, and it's a question I myself once asked when I was doing my global health thesis on planetary health as well. So the answer is it's pretty straightforward. It's excess resource and energy use driven by consumption and production patterns that are coming from predominantly rich countries in the global north. So we see here at this figure, it's from Oxfam. They showed that in the period of 1990 to 2015, it was 10% who were responsible for almost half of total carbon emissions, whereas the poorest 50% of the human population were only responsible for 10%. And of course, I don't have to stress that here on a conference on climate change. It's those poorest 50% who are vulnerable communities living predominantly in the global south that are bearing the biggest cost of the ecological crisis. So what then? So as you might have noticed, degrowth is not really a dominant frame that we see in climate global politics and debates on ecological issues. What we basically, including at COP26, what we basically see happening there, it's discussions that occur under this banner of what you could call green growth. So green growth is this assumption that we can continue to grow our economies while decoupling while decoupling our economic activities from environmental pressures. The thing is, though, that green growth, unfortunately, it will not be enough. It has little grounding if we see in where we need to go to stay below 1.5 or 2 degrees and to get to the Paris agreements. We need to go farther than this. So absolute decoupling will not be possible in the short time that we have left. And the core problem really is it's quite straightforward. Again, it's as we continue to grow our global economies, even though they will become more efficient, more cleaner, fueled by energy resources that are cleaner or renewable, there will be more energy demand, and more energy demand makes a transition that we need to make only more difficult in a short time that we have left. So the next question then we need to ask ourselves is, even if growth were physically possible on a finite planet, is it then socially desirable? So what degrowth scholars then pose is that it's not. It's a growth-based economics that is not an effective mechanism for reducing global poverty. We know that since 1960s, the real capita income gap between the global south and global north has only increased. It has tripled. So it's basically as the world has become richer, so global GDP has gone up, it has also become more unequal. So as Kate Rayworth, a post-growth scholar, once put it, a growth-based economy is really a system that is divisive by design rather than distributive. We know as well that there's no direct relationship between human well-being and GDP growth. What we know from countless studies that have gone into this is that when you look at the relationship, there's this saturation curve. So first, and this is important, you need a certain amount of economic growth to achieve certain social outcomes, which is for sure in many countries in the global south. But at a certain point, the relationship falls apart. And this is, so it's a certain threshold that which countries have reached by far already. Meanwhile, We know on studies that have gone into if we can assure flourishing life for all within planetary boundaries, that we can. And we can do this with far less energy. But the point here is that rich countries will need to get by with less. And that's what degrowth states. So the battle for health equity and ecological justice, they're part of the same transformational project, which is the transformation to a post-growth world. So what then do degrowth advocates propose? They state we need to reduce our global energy and resource use back to sustainable levels in a just and safe way. It means that we do a planned downscaling of the economic throughput, which is the consumption and production patterns in our economy of only those nations, and it is important, who are currently overshooting planetary boundaries. So it's nations in the global north that we saw before, while distributing the wealth of the global economy more fairly, so we can meet the needs of all people. So what is important to understand here is that degrowth really is not only about reducing GDP per se. It really is about creating a total different economy altogether that can get by without more growth. So it's a totally restructuring of our economies with different policies. And so it's not the same as a recession that we saw now with COVID happening. So what then are these policies that would overcome this growth dependency of economies that we have now? So the first one, it's quite straightforward. It means scaling down our ecological harmful sectors while we invest in social security. So it's investing in public health, in education, in all those sectors of the economy that we need to live well. Meanwhile, we need to make sure that we can pay for this transition while reducing inequality, for example, through progressive wealth taxes or maximum income caps. We need to decouple livelihood security from wage work by reducing work hours, so we share the work that is then becoming meaningful, and we make sure that people have a right to a livelihood through a universal basic income. Another important step, and this is what we work on at Commons Network a lot, is relocalization over economic activities through promoting commons-based organizing. So I'd love to tell you more on that, but there's no time for that. And then lastly, and importantly, we need new indicators to measure progress in societal well-being. GDP, it was never meant when it was invented as a measure of human well-being. And while now we use it like that, it's enshrined in international agreements, even though something like the SDGs, but it's dangerous and it's undermining where we want to go if we want to protect and promote planetary health. So one short notice, since we are here on a conference where many voices from the Global South are coming, I want to point out that degrowth scholars, they really stress that there's an anti-colonial politics of degrowth. So degrowth really is rooted in environmental justice movement. It shows strong linkages with what is called post-development thinking. And it basically states that Southern countries should be free to organize their resources and labor around meeting human needs rather than around servicing Northern growth. So here's a collection of all those books and scholars that have written about these lines of thinking. Please reach out to me if you want to hear more on post-growth, degrowth thinking. Yeah, it's maybe nice to say that we recently launched a new report on this. So you're happy to go to our website or to send me an email. Thanks a lot.
Thanks a lot, Winnie. You know, it's the typical time slot in a conference when we have the right to feel tired, but it's not the case for this panel because it's really very, very interesting. And actually, I have a couple of questions coming from the public, so from participants. So let's just mention one for every one of you. And if you can answer really in 1-2 minutes maximum to keep on track. So my first question, actually, I mean, is not mine, coming from Giovanni, is for Rob. So during natural disasters, NGOs are really helpful for emergency response in countries with weak or weakened or overwhelmed public services. But normally, this response is the duty of civil protection governmental bodies. There is something done at global or national level to strengthen those bodies of civil protection? Rob, the floor is yours.
Thank you. Thanks for the question. Yeah, well, if there is something done, I think this question comes back to the classic humanitarian emergency versus development question or topics. Well, it shouldn't be an either or, but MSF as such, we are not really involved in developing civil responses to emergencies as such. I think what emergency actors can help in is identifying gaps, in systems that are not working and that should be improved. Or, for example, something was mentioned on rehabilitation and recovery after a flood as well. I think there is a transition that can be done from emergency to more developmental actors on that issue as well, where emergency actors often have a view on from the emergency phase on where specific issues, health-related issues, and so on are linked to poor water supply. And if that information is shared with more longer-term developmental actors, this can be a nice collaboration. But as such, myself, we are not involved in developing this kind of longer-term disaster response in countries. No.
Thank you. I jump directly to another question for Aquila and Lawrence from Marlies. So it seems that the project of Enable target national policy making. Is there any follow-up on the effects and impact of these national climate plans? Thank you. I don't know if you want to answer, Aquila or Laurence. Yeah.
Aquila, are you going to answer, or do you want me to answer?
I can answer, and then if there's anything missing, you can feel free to add. So in terms of follow-up in Mozambique's climate plan, some of the subsectors that are identified include water resources and health. And this type of project and approach, the desalination approach, has also been proposed and discussed with the National Directorate for Water Supplies and Sanitation, as well as with the NBA for review and green light. If it's being done in other places, it has been implemented in other regions where the water has been detected to be brackish. I hope that answers Marlise's question.
The solution was only for 3 provinces because it's a specific kind of thing that's happening in the south of Mozambique and not in the north, not at all.
Thank you both for those clarifications. I have one question for Winnie. It was clear in your slide that you don't like to speak about green growth, that green growth has many limits. So do you think that in this regards, COP26 have been completely useless?
So I think that I think in my slide I put a picture of a recent article from The Guardian, where they calculated, it was based on calculations by Climate Network out of my head, and where they stated that current COP26 agreements, they have us now on track for a world for heating more than 2.4 degrees. So with that being said, I do think that COP26 it's one of the things, of course, is the Global South voice is strictly missing of these climate negotiations, international agreement negotiations. And also, I do think when discussions, for example, about net zero by 2050, there's two complaints really, which is the by 2050, which is way too far if you look at the contribution that which countries will need to make if we look at the global target for 2050. Rich nations will have to speak about 2030 at the latest. And the other complaint is about the net. It really is about negative emission targeting. It's a specific way of green growth thinking. And like I tried to mention in my presentation, we know really from empirical research, so it's not my own view or degrowth views, it's really studies that show that negative emission targeting is not, it's not going to get us there. It's not going to make us meet the Paris targets. So yes, I don't think we should talk only about net zero or carbon capture storage or these things that we currently focus our attention on during a COP discussion. Yes.
Thank you. Thank you very much. Michelle, so coming back to the beginning of our travel around the world, so you actually mentioned that how much important is to understand the adaptation and mitigation measure under the goal of universal health care access, leaving no one behind. So if you have any comment to share after having heard to our colleagues, please, the floor is yours.
Thank you, David. First of all, I want to congratulate Rob and Aquila for their very clear presentation, but also I feel they are convincing us on the way to be better informed, to make the relevant analysis before action and during action. I congratulate also, we need to try to link local and global politics. It seems to me from what we have heard from this session and from the speakers, transformation is a must if we want to cope with climate change, with climate emergencies, and especially for the sake of the most vulnerable people. So transformation is a must. How to do it? And I just retain from the presentation 2 points. The first one, it's the great opportunity we have today to be better informed. But if we integrate short-term and long-term prediction, if we hear local people, local participation seem to be a challenge, and how to link this with epidemiological models, climate models, and then we can use this information to act in a better way. Related to emergencies, and this was very clear with the ROP presentation, they are using this information for even for short-term reaction, how to act. And he mentioned the need to have, for example, a 2-week alarm system to be ready to react in a better way. The timing frame, and this is the second point I wanted to make, and this was very clear from Aquila's presentation, how to adjust the decision-making process based on the ongoing feedback we receive from the communities, from the projects, and the way this information is linked with the politics. I like this very much, the dynamics which is behind, and if we manage in a better way this kind of dynamics, maybe it's a way to understand better what Winnie was expressing. So I wanted just to say that in these few words. This is my first reaction, but congratulations for all the speakers.
Thank you, Michel. I know that there are other questions, and it's great because, of course, those experiences, real experiences and thoughts are generating more questions. I see that we have only 1 minute, so I'm so sorry, but we can continue, of course, the exchange on the chat, but I'm going just to thank all panelists, all participants for sure, and the organizer in the backstage. So thanks a lot. And so back to Annabelle. Thank you.
Yes, Davide, I heard you have more questions. Are there many? Because I can give you some extra time if you want.
Okay, great. Perfect. So I see one for just let me picking it from Jessica for Winnie about how we can act concretely in the growth society. A huge question. If you want to react, Winnie, please.
Yes, great question. I believe I don't have the time in presentation to say enough about this. It's always hard to say all you want in 10 minutes. So it's always great that you have question time. So there's, when the degrowth movement started or let me put it differently, when the degrowth movement got bigger in the beginning of 2000s, it was really focusing on why we need degrowth, what I was also a bit emphasizing in this presentation. During the last 10 years, it's shifted to how we are going to get there, how a degrowth society will look. So it's really what I want to stress is that this is really a focus now of recent degrowth books that have come out, degrowth articles. So first, and this was the slide with degrowth policies that I was showing a bit about. But from your question, I also understand a certain personal, individual focus, like what can I do? How do we relate personally to each other in a degrowth society? And what's important to understand here is that degrowth scholars really also focus on the central values that will be put center stage in a degrowth society, which are inherently not growth focused. So one book by a scholar, Timothy Pariquet, he says that the three central values in a degrowth society will be autonomy, sufficiency, ecological sufficiency, and care, with which we mean care for each other, interpersonal care, and care for the environment. So that being said, it means that we're indeed going to be way more locally focused and focusing more on community organizing, on cooperative, collectively organizing, which is often why degrowth links to things like food co-ops, to eco communities, to energy corporations, these things of collectively managing our resources and providing services and responding to our human needs. So if that helps, but I would love to send some books that you can read about this, because there has been there's a huge collection of literature on it.
Thank you. Thank you. Really, the last question, just taking advantage of the extra minute give us from organizer. So it's from it's for Michel. I can read it as it is in French. So bonjour Michel, ta troisième piste.
Yes, your third track was to mitigate climate hazards in the poorest population, the most vulnerable group. It's not really a question, it's more a comment on inequalities. What can you say? Yes, I can give you a very, very concrete and maybe limited answer. We know that in a lot of African countries submitted to drought, malnutrition is basically soaring during the pre-harvest season. During the pre-harvest season, it's basically a highly vulnerable season, and there are a few projects where the mutual insurance systems, the local insurance systems, facilitate the access to healthcare system, for instance, through transportation during the specific period of time. Why? Because at that time, farmers haven't a lot of food and they haven't a lot of money. The lack of money has an immediate impact, a direct impact on small girls. If you have to pay a fee to go to school, well, small girls, little girls won't go to school anymore because there is no money for these little girls. So if you look at how climate can influence the economic life of farmers and also the impact on health, we can imagine better solutions, maybe limited in time, but targeted on poverty issues. So this is the first thing. The second element, in rich countries or in poor countries, the capacity to the resilience depends on social cohesion, and that's very difficult to perceive. For instance, after the Second World War, the population in Berlin, how they react when they had deep family contact, it was much easier. It's the same after floodings, after earthquakes, and I saw it also after the tsunami in Sri Lanka, identifying the groups which have difficulties in rebuilding. For instance, if you look at climate change as vulnerability, not as exposure, but as vulnerability, so the capacity to react, then it changes the paradigm of our reaction, how we can adapt our project. Shall we, of course, we have to take this population into account, but the point is they are often not very visible.
Yes, please, but very, very short.
Yes.
Because we are...
There was something very clear at the COP26. Everybody is speaking on adaptation and mitigation, but there is a third component that is appearing more and more now, and it's on loss and damages. And on loss and damages, they are studying what can be done for reinsurance and all these things. And that's a new component that's appearing now, and people are speaking more and more about that. And that's maybe something that we can take with us now. It's something more recent, because it's clearly when you have big effects on climate, loss and damages it's another thing that you have to take in account. And then that's only an extra point who is clearly.
Thank you. It's great that is a never-ending debate. So we just started thanks to this conference. So let's move to the next panel and stay tuned. Thanks, everybody. Back to Annabelle.
Yes, thank you very much. Merci beaucoup, Michel et Davide. C'était fantastic. Thank you for giving us some perspectives and some other points of view, because it's very diverse, the way we have to look at it and see how people around the world react on this climate crisis, or can react and can reinforce each other.